Hi, my name is Peter Newbold. I live in Seattle, Washington, but for most of my professional career worked in D.C. on health insurance issues in the U.S. House of Representatives, and then as a lobbyist for American Psychological Association on issues like Patients' Bill of Rights, mental health parity, protecting people's access to quality mental health services. Did a lot of coalition work, and Families USA, this co-sponsor of this event, was a good partner for us on behalf of families and consumers. So it's going to be interesting, I think, to hear Vicki Kennedy, John Lewis, Steny Hoyer, and other speakers today give us an update on the prospects for healthcare issues in the next couple of years.
My name is Dr. Luella Tony Lewis. I'm proud to serve you as co-MC with my colleague Ron Pollack right here. I am a family doctor and a geriatrician, but I'm also extremely proud to serve the Service Employees International Union as the chair. All right. As the chair of our healthcare division, where there are 1 million doctors, nurses, home care, hospital workers that take care of you all across the country. So glad to be here representing them across the country in Canada and Puerto Rico. And on behalf of SEIU and our partner Families USA, we would like to welcome you all today to this event and thank you for making time in your very busy schedule. It's been pretty awesome so far in North Carolina, yes?
All right. The number of people who are uninsured were growing and growing towards 50 million people. And now the Affordable Care Act promises to expand health coverage for tens of millions of uninsured people. So the reason we're here today is we're here to celebrate the historic accomplishment of the Affordable Care Act's passage. And we are here today to rededicate ourselves so that no politician can take it away. Vicki Kennedy is a brilliant leader on issues ranging from health and education and labor. She stood at President Obama's side as he signed the Affordable Care Act. She continues to discuss the benefits of the law to constituency groups around the country. She is co-founder and president of the Board of Trustees of the Edward M. Kennedy Institute for the U.S. Senate in Boston, which is invigorating public discourse and inspiring a next generation of leaders. Please give your warmest welcome to our good friend, Vicki Kennedy.
Wonderful memories of Teddy. And thank you, Dr. Tony Lewis, so much. I tell you, what a fabulous place to be here in this NASCAR Hall of Fame. As I walked in this morning and I took a look at these speeding race cars on this racetrack, I said, what a terrific metaphor for healthcare reform. We've been racing along the track for so many years. We've had our crashes and our burns. But we've always continued the race, and we finally gotten to the finish line. I love that. For me, this is a very bittersweet moment. Sweet because we have gotten to that finish line. Of course, as we know, that race is going to keep on going. We're going to keep on making it better. But also, because I miss Teddy. I think we all miss him so much. Because if he were here, he would be here. He would be here celebrating how far we've come, and he would be encouraging us to keep on going further, to keep the fight going, to keep getting things improved more, because that's who he was. I don't know if you were in the arena last night or if you watched on television. what was a really beautiful video tribute to Teddy, which harkened back to the convention, really to his entire career, but to the convention 4 years ago in Denver. And there was one particular moment where they flashed to his words that Ron just alluded to, where he stood at that podium and said, "I have new hope, and this is the cause of my life, that we will finally guarantee for all Americans." And then his voice changed and he said, "North, south, east, west, young, old, decent, quality, affordable health care, for all Americans." It was so powerful. It was so powerful. And he was so determined to be there to make that case. And he did make that case. And with all of you, and with all of his colleagues, people he loved working with so much, with the leadership of President Obama, with the leadership in the House and the Senate, and I have to give a special shout out to Nancy Pelosi, who's going to be here a little later. She was so phenomenal in that battle. I have to give her a special shout out. To all the members in Congress who were really, truly profiles in courage, true profiles in courage, because the winds were coming at them, and they stayed the course and they fought for what they knew was right and good and just. This reform happened. And as I was also watching that film, I saw this great debate between Teddy and Mitt Romney going back to 1994. Great. Outcome was great too. But what I really remembered was 6 years ago. Another time in Faneuil Hall, Ron, watching the signing of Obamacare, being in the front row at Faneuil Hall. The staging was extraordinary. I had never seen Faneuil Hall so dolled up. Mitt Romney, you should watch it on YouTube, I encourage you to. Mitt Romney said, "I think this stage has been set by Cecil B. DeMille." He was using it as his platform to run for president. It was his shining achievement of his governorship. And it was a shining achievement. He stood up on this heightened platform, and he was surrounded by Republicans and Democrats. It was the coming together of federal and state partnership. It was the coming together of Democrats and Republicans. It was the coming together of the government and private industry. It was public, private, Republican, Democrat, federal, state. It was everything it should be, where we had health care for all in the Commonwealth of Massachusetts. Romney Care. It was a huge, and is a huge success. And I believe my governor, DeVal Patrick, is going to be here a little bit later, and I know he's going to talk about the incredible success it was. And what healthcare reform meant in Massachusetts, what the goal in Massachusetts was for it to be a laboratory, for our state to show the world, to show the country what it could be, what success could look like. And it is beautiful. You couldn't take health care away from the people of Massachusetts kicking and screaming. We love it. Over 98% of our people are covered. We have the best hospitals in the world. Massachusetts General Hospital was just ranked #1 in the country. That's what it looks like when you've got good health care reform. We don't have worse health care. We have the best health care. We have the best health care. And that's what's going to happen here with Obamacare. It is the benefits continue and continue. And that when the states show the federal government how it can happen, we have another little thing that's happened. The federal government with Obamacare is showing the states what to do. Because of the cost containment provisions that exist in Obamacare, Massachusetts is learning a thing or two. And now we're using some of the provisions of Obamacare to incorporate new cost containment measures in our state healthcare system in Massachusetts. So it's a win-win situation. We have all of us saying yes to healthcare. And the reason that all of the people are going to say yes to healthcare over and over is because it impacts real lives. And that's really what this is about, isn't it? That's the real story here. We're talking about the impact on real families and real lives. I've never been prouder of anything I've ever worked on in my life, and I've never been prouder of anything my husband has ever worked on in his life. And I thank you for everything you've done to make it a reality. Thank you.
Throughout his long career in public service, from his days in the Maryland General Assembly to his decades of leadership of the Democratic Party in the U.S. House of Representatives, Steny Hoyer has led the fight for good jobs, access to quality health care, and retirement security for all. Congressman Hoyer's word is his bond. He is a tireless fighter for the middle class, and he knows how important it is to continue to fight for every benefit we want to deliver and every insurance protection under the Affordable Care Act. And we all will be there to help him win back in the majority in November.
All right.
All right. So let's give a warm welcome to our friend, Congressman Hoyer.
Good morning. Are we re-fired up? All right. I thought Michelle Obama knocked it out of the park. Talking about how her husband has stayed true to his values. That's what America wants. To stay true to our values. That's what this meeting is about right now. Staying true to our values. You know, there's an argument about, is this a right, or is this a wrong, or this is what, da-da-da-da-da. Does anybody in this audience, does anybody in this country believe we're going to be a successful country if we're not a healthy country? And the answer to that question is clearly no. And for almost 6 or 7 decades, perhaps a century, if you start with Teddy Roosevelt, we've been trying to accomplish what Barack Obama, and let me say especially, I don't know whether it's been mentioned today, but I worked day to day, literally minute by minute. Nancy Ann was there all the steps of the way. One person who was focused like a laser on passing health care. One person who would not back up a single inch when suggesting that it was not going to be comprehensive health care. One person who, by dint of her character, her courage, and her strength, made this happen. I want to say that Nancy Pelosi is going to go down in history as one of the authors of this. They want to take us back. The Romney-Ryan retreat wants to take us back to the days when children with pre-existing conditions were prevented from getting coverage. This is a cause for America, a cause for seniors, a cause for women, a cause for men, a cause for children, a cause for a healthier and better America. Let's get re-fired up. Let's get the job done. God bless you. Stand up, because I'm about to introduce the congressional heroes of the Affordable Care Act. For all of us who work to help pass the Affordable Care Act and we're deeply grateful to President Obama for making it happen. We all know there was one person in the United States Congress who stands out as the hero of that fight, as Steny Hoyer mentioned earlier today. There is one person who stands out who had the legislative backbone of that struggle. When some were worried about controversy the legislation generated, like the various Tea Party demonstrations, when some suggested that the Affordable Care Act should be jettisoned and instead we should play small ball, Nancy Pelosi never wavered. Nancy Pelosi kept her eyes on the prize. She provided the leadership and the backbone. Successful movements have different authors, but she should win the Pulitzer Prize. Please introduce the previous and soon-to-be Speaker of the House,
Dr. Lewis, and for your leadership. What an honor to be here with all of you. This is a very important meeting because it's placed a time at this convention where we can come together, take stock of what we have done, and figure out how we go forward. And we have a great leader to lead us down the path to go forward, President Barack Obama. I want to say to Sanders USA, thank you for your leadership during this fight. You told the stories of America, and that was the strength of our arguments. Whether we were in the Rules Committee or on the floor or in town hall meetings or wherever, the stories, the facts of life, the facts of America's family's life were the most compelling arguments of all. And that's not all you did. And SEIU, I see Andy Stern here. He knows that we've been working for 30 years with single payer. Where'd he go? He leave us for 30 years on the single payer. We didn't get that, but we got something that will serve the purpose. Mary Kay Henry, Madam President, thank you for your tremendous leadership in all of this. We're a total partnership. So I take credit on behalf of them, but I take pleasure in thanking you for the role you play. Because we had some dark days when the press would come and say, how do you think you're going to get this bill passed? Now again, I mentioned Andy and 30 years ago. We have been, for some of us, working on this for a very, very long time. We were not going to allow the opportunity of a generation, and God knows for how long into the future, we have another opportunity to have health care in America as a right for all, not just be there for the privileged few. We saw it as the most transformative issue because it was about life, liberty, and the pursuit of happiness, honoring the vows of our founders. Life, a healthier life, liberty, the freedom to follow your passion, not your policy, your insurance policy. You are no longer job locked because you had a pre-existing condition in the family. Life, liberty, to pursue your happiness, your goals, again, your aspirations, your talents, what you could bring to our society and to our economy. And so it was transformative in the lives of people. It's also transformative in the life of our economy because this is a competitiveness issue. And if we had no other reason to pass the Affordable Care Act, it was because the present system then, the current system then, was unaffordable. Unaffordable to individuals, to families, to small businesses, to major corporations, to public entities, and certainly not affordable to the federal budget. So we had to reduce the cost, improve the quality, expand the access. We firmly believe the most privileged person in America would have opportunity for the best possible care and better care if the poorest person in America was in the loop, if everyone was in the loop. So, we put forth the bill of action. It's not just about the great leadership, the extraordinary leadership of Barack Obama, and how important it is for us to elect a Democratic Senate, to increase our numbers there, hopefully, and to elect a Democratic House. This election is about the survival of a pillar of our society. Since it's Labor Day week, I'll say, Walter Reuther said years ago, the bread box and the ballot box cannot be separate. They go together. If you want the right policy, you have to have the right politics. And that's why I'm calling for campaign reform to take the role of money out of politics, because the special interest politics, if you dare disclose, I'm Nancy Pelosi and I approve this message. I have to say it, everybody else has to say it, but not the billionaires who are putting tens and hundreds of millions of dollars on the table paying for ads nobody knows. Disclose, transparency is key. Amend the Constitution to overturn Citizens United. Reform the system. Let us have public financing of campaigns. Let's take us all the way to that place. And elect reformers who will do this. And I don't care if they're Democrats or Republicans, just so long as they want to support our democracy and stop it from becoming a plutocracy, a government of the rich, of the few. So let's have a government of the many, not the government of the money, that will have an impact on our policy, and reduce the role of the special interest. And when you do, reduce the role of special interest money, and raise the level of civility in the debate by talking truth, you will elect more women, more minorities, and more young people to public office. I promise you that. And that's a very wholesome thing for our country. So thank you for all that you did to pass the Affordable Care Act. Special thanks to Ron Pollock and Families USA for being totally indispensable to the cause. And Dr. Lewis, thank you, and SEIU President Mary Kay Henry, and to all of you who visited from around. Isn't it exciting that we are going to re-nominate Barack Obama and Joe Biden and re-elect them President and Vice President of the United States? Thank you all.
I would like to introduce another one to you. Governor Deval Patrick has led the way in achieving near universal coverage in Massachusetts and making sure working families and small businesses alike have more affordable health care options. And now the governor is leading the Commonwealth on the phase 2 of health reform for his state, lowering health care costs. Part of that plan also includes investing in training and education for new and existing healthcare workers, something we all know is key to ensuring quality of care over quantity of care. We thank Governor Patrick for his fearlessness and tirelessness in showing all of America what is possible when government, business, healthcare providers, and healthcare workers work together to take on the great challenges we face. Y'all heard him last night, right? Heard the governor? Let's give a warm welcome to Governor Patrick.
Thank you very much, Dr. Lewis. To you and to the extraordinary Mary Kay Henry from SEIU, to Ron Pollock, to my brothers and sisters, it's good to be with you this morning. It's terrific to be, for one thing, in the company of positive people interested in doing positive things for the good of the country. It's also really good to be at a convention where facts actually are welcome things. It is a fact that the President's Affordable Care Act is a victory for all Americans. Millions of young adults, as you know, are able to stay on their family's plan until they reach 26 years of age. Insurance companies can't deny coverage for a pre-existing condition or charge women more for coverage than they do for men. Preventive care is now covered, including mammograms for women and wellness exams for seniors. Seniors on Medicare can afford their medications. Indeed, Medicare itself has been strengthened. A Republican governor, a Democratic United States Senator, Ted Kennedy, a Democratic legislature, a broad coalition of business and labor and policy leaders, healthcare experts, and others came together to invent Massachusetts healthcare reform. Like the Affordable Care Act, it relies mainly on private insurance acquired in the private market with subsidies for those who have trouble paying those premiums. The coalition realized that nobody could possibly foresee all the consequences and questions that would arise in the future from such a big initiative, so they committed to stick together. And they have stuck together to refine it and improve it and strengthen it as we implement it. The bill took effect the day that I took office. By any measure, our progress has been impressive. Over 98% of our residents are insured today, 99.8% of children. I don't think there's any other state in America that can touch that. Over 90% of our residents have a primary care physician, and 4 out of 5 of them have seen their physician within the last 12 months.
Yeah.
More businesses, not fewer businesses, are offering health insurance to their employees today than before our reforms took effect. The national average is about 69%. In Massachusetts, it's 78%. We're healthier. Preventive care is up. More people are receiving cancer screenings. More women are getting prenatal care, and non-emergency visits to emergency rooms are down. And health reform at home has become a competitive advantage as well, attracting young entrepreneurs who know that they can come to Massachusetts and start a new company and still have access to good care for themselves and their families. I remember not too long after I was elected, Governor Romney called and asked if he could come in with his portrait artist one weekend to prepare for the portrait, take some pictures and so forth. We said, of course. And he came in, and the portrait was unveiled, I don't know, a couple years later, and it hangs in the sort of entrance area of the governor's office in the State House at home. And there is Governor Romney sitting on my desk with all my pictures behind me. And there are 2 things that have been painted in by the artist. One is a photograph. It's a picture of a photograph, a painting of a photograph in an easel of Mrs. Romney, really beautiful, on the credenza behind the desk. And the other thing, and only other thing, that is added to that portrait is a painting of the health care reform bill sitting on the desk next to Governor Romney. He believes in this. He's proud of it, and he should be. It's helped a lot of people. The problem, I think, is that the Affordable Care Act doesn't poll very well nationally. And there's not a doubt in my mind that if it polled better nationally, Governor Romney would wrap his arms around it. That's an integrity question. That's an integrity question. We ought to wrap our arms around it. Because this is, in my view, about how we help people help themselves. How we reflect the best of who we are and the best of what we want our country and our communities to be. This is worth fighting for. Now let's get out there and fight for it. Thank you so much.